great to see you today. Thank you so much for joining us on this series of videos that we're doing for We Are NHS. I wonder if you could just introduce yourself, please.
Well, certainly, yeah. I mean, first of all, thank you for inviting me to talk about this. I'm Munir. I'm primarily a GP, but I'm also an educator. So I work as a trainer, tutor, teach medical students, appraiser, and have various other roles. And I'm also working as an AD for what used to be AGE, but is now the WT&D of NHSE. And I'm also a podcaster.
I'm fascinated by your podcast. We have listed many episodes of the Primary Care podcast on We Are NHS. I wonder if you could tell me a little bit about how the podcast came about.
Yeah, certainly. So, in fact, I've got two podcasts now that I'm involved with. The first one, and the one that I've uploaded some episodes for, and which has been going on for a couple of years, is Primary Care UK, Let's Learn Together. And more recently, I've started the Clinician's Survival Guide, which I'm really excited about, and I'd just like to mention it towards the end, perhaps. But coming back to Primary Care UK, where that came from, actually, when we were coming out of the pandemic, one of the things I realized is that people were starting to get webinar fatigue. And if you think about it, it's a bit unnatural, isn't it? Expecting human beings, I mean, think about the history of humankind, to actually sit in front of a screen for 2 hours just staring at it, a bit like we're doing now. It's not very natural. And the concept of actually utilizing podcasts as a medium for information and learning was relatively underutilized. And it had the benefits of, well, it's a more healthier option. And I wanted to target clinicians because that's who I am, and that's what I know. And clinicians tend to be very busy. I mean, they certainly we perceive ourselves to be very busy, that's for sure. And podcasts allow you to multitask, so they're also a very efficient use of time. Now, when I decided to do focus on clinicians, the immediate question was, okay, but what do I actually talk about? And I know that I love teaching. I know I love sharing what I know or think I know. That's why I have all these teaching roles. But something became apparent. Now, here's the thing. More important, it seemed to me from conversations with clinicians, more important than their need for education was something else that was bothering them and still is in some ways, at a much more fundamental level. It makes me think of Maslow's hierarchy of needs. But there's this anxiety with the vast change in roles, the acceleration of change roles that has been taking place, certainly in primary care, where there's all these new roles coming on board. And while this certainly creates opportunities, and where each new role has something new and special to offer and bring more richness to primary care, I mean, there's no doubt about that, it was also creating some challenges. And doctors and nurses were sometimes not so sure about job security anymore, whereas the newer role professionals were sometimes feeling unsupported and not sure exactly where they're supposed to fit in. My mantra for a while has been, if you want to work together, then you should learn together. And so I wanted to make a podcast which provided education, but was absolutely for a multi-professional audience, not a GP podcast pretending to be multi-professional or anything like that. And this is something that I'm proud of, that every single episode has that multi-professional feel to it.
In terms of what you love most about hosting the Primary Care podcast, what's perhaps, I'm not going to ask you to choose one thing, maybe there's three things. What are your top three things that you love most about doing it?
I think number one on the list has got to be the enthusiasm that I encounter. And enthusiasm is contagious, I believe. So when I get speakers on, well, the first thing that really made warm towards the podcast was when I first started it, I wasn't sure if anybody's going to give their time. These are clinicians, these are experts who have got other things to get on with, and I'm not paying them anything for this. Why would they even bother to? But actually, one after another, I was having experts who were so enthusiastic to talk about their area of expertise in a way which enhanced the delivery of education. So I learned from it. It encouraged me. When somebody teaches you something with enthusiasm, you actually want to follow what they're advising you to do. And then there was enthusiasm from co-hosts. So one of the things that I really feel is important to mention is that, and this really touched me, when I started this podcast in season 1, I did it mostly on my own, and I just tried really hard to make it multi-professional and using whatever strategies I could. And I had some experience in multi-professional education. But in season 2, I decided that at the end of the day, I can't be anything but a GP. I can't be anything but a doctor. And I was very lucky to have the support of a whole range of multi-professionals, nurses, physicians, associate, clinical pharmacists. More recently, we have paramedics who are part of the team. And during season 2, they contributed willingly, enthusiastically, representing their regions without being paid a single penny for this. And this really kept me going. In season 3, I do reimburse them, but even now they do this out of their desire to represent their profession, their desire to represent their region, and because they have something very valuable to contribute. So, where was I? So again, this touched me as well. And so this is the other thing I loved, was the enthusiasm that came from the co-hosts. So that's got to be probably one of the most important things. I also find that it's quite natural that as a host for an episode, I find it a very useful way to learn, because I have to be paying a lot of attention, and I've learned things. And just while I'm saying to this, one of the examples that comes to mind is the episode on health coaching, because when I agreed to interview an expert on this, my attitude towards this was, well, I'll do this anyway, but I mean, why would I care about health coaching? And I have to, honestly, and at the end of it, I was totally transformed. And now I would say to every clinician out there, you need to know about this topic. So this kind of transformation is very valuable for me. It makes you realize how much importance there is for us to always be open-minded about things. So I've loved doing this, and I honestly have loved every single episode. But a few that come to mind. Well, first of all, sometimes I've really enjoyed it because of the person that is the guest speaker. Now, I was very lucky to have input from Navina Evans, who was then the Chief Executive Officer of HEE. And it was because she had a very personal connection with the topic that was being presented to the audience, which was racism in the NHS, or racial discrimination. I mean, this was quite a hot topic at that time. I think it still is. So that's one example that comes to mind. Likewise, I was very lucky to have input from Professor Roger Neighbour, who was at one point the president of the Royal College of GPs, because I've really been inspired by his advice on consultations. It was his book, The Inner Consultation, that inspired me and allowed me to develop my consultation skills. So there are some examples like this. Another one that comes to mind is more recent. I was really pleased to have a little bit of input from Rosamond Adu Kisi Deborah, who you may know. She's the mother of somebody who passed away with asthma due to pollution, and the topic was about air quality. You know, when people have that personal connection, then I feel very lucky to have them on, because it's not somebody just trying to cover a topic. It means much more to them, and that connection comes across and has an influential effect, I believe. Sometimes I've been excited more about the topic in question. Sometimes, so the topic in question, one that comes to mind is more recent episodes where we've been talking about patients who are marginalized. So those who are likely to get neglected, the homeless, easily neglected. So I was really pleased to speak to somebody who actually knows something about this. So the homeless, learning disability, these are again patients who get neglected, mental health. In fact, I have to say it's thanks to Irina, who's part of the team, our team, and she was the host for that session. And it's really nice the way mental health was covered. And I tell you, I was listening to every minute of that, and I learned so much about it. It was a really interesting way of covering the topic. And I could go on and on. I mean, there's just lots of great stuff being covered on these episodes. And I see myself as being a student. That's all.
What's your biggest challenge with recording these podcasts, do you think?
Money. So yes, there was a steep learning curve. I did some courses on podcasting. I've attended seminars and online forums and attended functions, so I've trained myself up to a good level now. But the challenge is always going to be funding. And I have been fortunate to receive a little bit of funding from a few different sources, which are available on our on the main podcast website. But more recently, the North Thames Medicine Genomic Service has been sponsoring some episodes on genomics, which is again very interesting. But there isn't really a continued backing behind this. And I spend, by and large, this is me funding it out of my own pocket, really, which I can manage for now because I do have a job as a GP and the other roles that I do. But of course, it's not sustainable long term.
Mm-hmm. Is there a solution to that, do you think? Is there an opportunity to get funding elsewhere?
I've tried to avoid including those irritating ads that are often found in podcasts.
Yeah.
So perhaps this is something that I might eventually have to turn to. Otherwise, I have received funding from the likes of trading hubs and related organizations, and I just continue to be on the lookout for that. But the team that I have across the UK supporting this, that really keeps me going as well.
Yeah. And can you tell me a little bit about the new podcast?
Yes, absolutely. So while Primary Care UK, Let's Turn Together, amazing, lots of brilliant speakers, there's something that's been bothering me for a few years, and that is there isn't really a resource out there to give practical hands-on advice on what to do about the general challenges that we are facing as clinicians. Now, I think this applies across the sector, but primary care is the bit that I know most about. And on the one hand, you can find clinical advice, how to care for your patient, and that has to be our priority, of course. There's also some resources about how to look after yourself as a person and well-being, stress management, resilience. But there isn't actually practical advice about what to do about this and what to do about that. So topics, what I'm talking about are topics like complaints. How do you deal with a complaint? And what I mean is, how do you deal with a complaint? Not what is the process you have to follow, but how do you cope with that? How do you manage it? What is the right thing to do and what is the wrong thing to do? How do you find the right job? How do you manage your time? Negotiating pay if you're taking it, and if you're even having that conversation with your potential employer. How do you manage workload? These are very significant challenges that we're facing in primary care. They are challenges, by the way, that have come out in a recent GMC survey as well. So everybody knows about them, but nobody seems to be talking about the solutions. And partly because I don't think anyone has very definitive, undeniable answers, unambiguous answers. And but I do think that we need to be having conversations about this. And what I do is I along with the support of the team that I have, I try and provide the best advice that I can and share from what I've learned and from what I have learned from others' mistakes and experiences, because we need to retain the workforce. So this is our way of trying to do our little bit towards that. And these episodes are every week, released on a Tuesday, and they're short. They're only 15 minutes, maximum 15 minutes, because people out there are busy. They don't want to hear 2 hours discussion about workload. They'd rather hear short and sharp advice. And that's what I try and do.
Thank you for joining me today. I really appreciate your time. It's been great to hear more about the Primary Care Podcast. I look forward to seeing next episodes that are released as they come out.